Good evening, everyone. So, should we start? Good evening, everyone. Am I audible and visible? Should we start? Please give a thumbs up so that we can start. Yes, Dr. Halley has given us thumbs up. So, yes, let's start. So, these were some instruments we have discussed. So, this is Hagar dilator, and number 5 it is Hagar dilator, and number 6 is Ellis forceps. Somewhat similar is the Valsalem forceps. Valsalem forceps is used to hold the interior. Valsalem forceps is used to hold the interior cervix. Okay, if it is curved as this one is curved, can you see this is curved? Then it is the Ellis forceps. If it is not curved, if it is curved, then it is Valsalem, and if it is straight, then it is, of course, it is Ellis forceps. Okay, so as it is curved, it is Valsalem. Okay, and if it is straight, same shape, and if it is straight like this, then it is the Alice forceps. Okay, and on the number 7 is sin speculum. Okay, and at number 7 it is the sin speculum. Okay, going to the teratogenic drugs. Now let's study the teratogenic drugs. In this chapter, we will only study 10 lines, and we will score very nicely. Okay. So teratogenic drugs are those drugs which, if taken in pregnancy, then they cause a lot of problems. Okay. A lot of anomalies to the fetus. Top on the list is warfarin. If one takes warfarin, then the syndrome which occurs is Condrati syndrome. Question has come on its each and every line. Please be careful while reading this drug. Condrati syndrome. Okay, Condrati syndrome. The chondrodysplasia. It is also known as chondrodysplasia. Chondrodysplasia punctata. Okay, it is also known as chondrodysplasia punctata. What is chondrodysplasia punctata? Chondrodysplasia punctata means that cartilage, chondro means cartilage, dysplasia, cartilage is not formed properly. Okay, there is a proper there is a proper dysplasia, right? Chondrodysplasia, there is a proper malformation of that cartilage, and it is formed in punches. Okay, punctata. So, when a patient is using warfarin, when the patient has to thin its blood, जब उसको अपना ब्लड थिन करना होता है, then a patient uses warfarin. So, if a patient gets pregnant, now the patient will have to stop the warfarin, and replace it by heparin. Either it can be unfractioned heparin, or it can be the low molecular weight heparin. Any of them can be there. And this replacement is done only in the first trimester. Okay, this replacement is done only in the first trimester. After first trimester, again the warfarin is started. Again, the replacement of the warfarin by the heparin occurs at 36 weeks. Okay, again occur at 36 weeks till delivery. You have to give only heparin. So, warfarin is replaced by heparin in the first trimester and after 36 weeks. Why it is replaced after 36 weeks? Because after 36 weeks, now delivery will occur. Okay, and warfarin has a very long period of action, whereas heparin has a very short period of action. So, as per bleeding, we can adjust the dose of the heparin. That's why. Okay, lithium causes abstain anomaly. What is the anomaly caused by the lithium? Lithium causes abstain anomaly. What is the problem in the abstain anomaly? There is small left ventricle. The right ventricle of the fetus gets very small. Okay, and this lithium is such a toxic drug that it is contraindicated in lactation too. Okay, but the warfarin is not contraindicated in the lactation. Warfarin is not contraindicated in the lactation. Only drug which is contraindicated in lactation is lithium. Okay, and the anomaly name, this was a question in FMG 2020. What is the anomaly caused by lithium? Okay, the name of the anomaly is abstain anomaly. In abstain anomaly, basically there is small right ventricle. The another drug which causes lot of teratogenicity is diethyl stilbestrol. It is nothing. It is synthetic estrogen. Okay. Just as in these days we give progesterones to the patient who have threatened abortion. Similarly, in 2015 around we were giving progesterone. Along with progesterone, we were giving estrogen also. But this estrogen caused a lot of teratogenic effect. Let us see what it caused. There were different effects in the female and there were different effects in the male. This has been question asked in INSET November, so there are chances that they can be asked to you also. Very basic questions were asked this time in INSET November. Vaginal clear cell adenocarcinoma. Okay, vagina clear cell adenocarcinoma. Vagina clear cell adenocarcinoma. Vaginal and cervical adenosis. The vagina and cervix, due to the axis estrogen, get adenosis. They get adenosis. Okay. Next is T-shaped uterus. Okay. Next is T-shaped uterus. Next is T-shaped uterus. Okay. Uterus gets its shape T-like. And there are absent fimbria. That is, cervix vagina gets affected, cervix get affected, uterus gets affected, and fimbrias, they get absent. Okay, these are the changes which occur by the use of estrogen or diethylstilbestrol in female. And what are the changes which occur in male? These have been asked previously. The changes which occur in male are cryptorchidism, testicular hypoplasia, hypospadiasis, and phimosis. Okay, in female, nothing happens to external genitalia, but in male, well, much lot happens to external genitalia also. Okay, so there is cryptorchidism, testicular hypoplasia, hypospadiasis, and phimosis. So these are the changes which occur with which occurs with the estrogen intake. Carbimazole and methimazole, these are the anti-thyroid drugs. Okay, now if these drugs are given to a pregnant lady, it causes choanal atresia and aplasia cutis. What is choanal atresia? Choanal atresia means the choanas, they don't develop. There is atresia. Okay. 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 No, Dr. Isra, started just 5 minutes back only. We are on third drug. Okay. Carbimazole and mm, carbimazole and the methimazole, these are the anti-thyroid drugs which are uh, which are uh, not safe for the pregnancy. They are the anti-thyroid drugs. They cause choanal atresia and aplasia cutis. What do you understand by aplasia cutis? Aplasia cutis means that skin is absent. Cutis means skin, and aplasia means that skin is absent. Okay, have you got this? Okay, used for, then what we will give for the as an anti-thyroid in hyperthyroid patient in pregnancy? If carbimazole and methimazole both are unsafe, then what we will give? We will give PTU, propyl thiouracil. Okay, we will give propyl thiouracil. Is it okay? Because propyl thiouracil is safe and we can replace it by carbimazole in the second trimester. Okay, one of this drug is sure going to come in your exam. Indomethacin causes premature closure of ductus arteriosus. Okay, indomethacin is a prostaglandin synthetase inhibitor and it causes premature closure of ductus arteriosus. It is used as tocolytic agent and it is used in the treatment of polyhydramnios. So we have to use it only for less than 32 weeks. Okay, we have to use indomethacin as a tocolysis or as a drug to reduce the polyhydramnios only less than 32 weeks because it causes premature closure of the ductus arteriosus. Okay, because it causes premature closure of the ductus arteriosus. The next drug is isotretinoin. Right, this is a very dangerous drug. It affects 4 systems: CNS, CVS, facial defects. Okay, 3 system. Central nervous system is affected, cardiovascular system is affected, and facial defects do occur. Right, so isotretinoin is basically given in acne. Right, alcohol causes craniofacial abnormalities, behavioral problem, and IUGR. The whole of the central nervous system and the face problems are there. in the patient who are taking alcohol during the pregnancy. Okay, what is the effect of cocaine? Cocaine causes vasospasm in the maternal and fetal vessels both. The one effect which the cocaine causes is vasospasm in the maternal and fetal vessel both. Vasospasm. Due to that vasospasm, there is cerebral infarcts. Cerebral infarcts occur. Okay, cerebral infarcts occur, and as a result, microcephaly occurs. Okay, tetracycline is not that dangerous, but you should know that it causes discoloration of the deciduous teeth. Okay, tetracycline is not that dangerous, but it causes discoloration of deciduous teeth. Teeth get discolored. Only deciduous teeth get discolored. SSRI, this was a question in the recent INS set. SSRI causes pulmonary hypertension. SSRI causes pulmonary hypertension. This is very important effect. There is lot of problem in the patients who are taking antidepressants. Now if they will take antidepressants, pulmonary hypertension will occur in them, right? So other than behavioral defects, pulmonary hypertension occurs in the patients who take SSRI during the pregnancy. Okay, so this is a main problem of the patient taking. This was a question in the INS set November. So all the anti-epileptics, they are teratogenic. Okay, valproate, phenytoin, diuretics, all the diuretics and all the anti-epileptics are dangerous during the pregnancy. Okay, the most safe anti-epileptic is levetiracetam. Levetiracetam. Okay, the most safe is levetiracetam. The drug thalidomide, which was used in pregnancy, which was once used in pregnancy, it was seen to cause phacomelia. What is phacomelia? That the arms are absent, hands are absent. Okay, these days it has been approved for relieving the pain of cancer. Smoking only causes IUGR. Alcohol was causing central nervous system defects, IUGR, and behavioral problems. Cocaine was causing vasospasm in the fetal blood vessels as well as in the maternal blood vessels. So there was cerebral infarcts and microcephaly. But smoking causes only IUGR. Okay, thalidomide has been approved by the government for the last stage of cancer pains. It is also used in leprosy also. Okay, so that was all about the teratogenic drug. Once again, we will see the warfarin is a teratogenic drug which causes problem in cartilage development, and it causes Condrati syndrome. It should be replaced by heparin in the first trimester and after 36 weeks. Lithium causes abstinence anomaly in which there is a small right ventricle. It is also contraindicated in lactation. It is very toxic. Diethylstilbestrol is synthetic estrogen. It, when given, affects the female and male internal genital tract. In the female, it causes vaginal clear cell adenocarcinoma, vaginal and cervical adenosis, T-shaped uterus, absent fimbria. In the male, it also affects the external genitalia and it causes cryptorchidism, testicular hypoplasia, hypospadiasis, and phimosis. All the anti-epileptic and all the antidiuretics, they are dangerous. Okay, they are teratogenic, including the danazols and anti-neoplastic agents. Okay, the most safe anti-epileptic in pregnancy is levetiracetam. The thalidomide, which was once used in pregnancy for the pains, it was seen that it caused phacomelia, which is absent of hands and absent of arms, absent of limbs. Okay, these days it has been approved by the government in the last stages, for the last stages of cancer pain. Smoking causes only IUGR. Okay, the other teratogenic drugs are carbimazole. It causes guanal atresia and aplasia cutis. Aplasia cutis means absence of skin. Indomethacin is a prostaglandin synthetase inhibitor. It causes premature closure of ductus arteriosus if delivery occurs during its intake. So it is usually not given after 32 weeks. It is used as tocolysis and for the treatment of polyhydramnios, and it is given less than 32 weeks. Isotretinoin is an anti-acne drug for the acne treatment. It involves three systems: the facial defects, cardiovascular, and central nervous system. Alcohol, if alcohol addiction is there to the mother and mother does not leave alcohol during the pregnancy, along with the IUGR, it causes behavioral problems and craniofacial problems. Cocaine intake causes vasospasm in the fetus and in the mother both. Due to that vasospasm, there is cerebral infarcts and microcephaly. Tetracycline is not that teratogenous. It just causes discoloration of deciduous teeth. SSRI question has been asked in INS set. It causes pulmonary hypertension and behavioral defects. So from all these 10 drugs, one drug is sure to come in exam. Okay. So let us see the medical diseases and the infectious diseases in pregnancy. If there is any problem, then please write down in the chat box. Now let's discuss the medical diseases and infections in pregnancy. If what happens if the medical diseases occurs in pregnancy, starting with the most important question, hepatitis B. Okay, so hepatitis B infection, if occurs to the mother in pregnancy, then the chances of vertical transmission, that is transmission to the fetus, is maximum around the birth. Okay, and it is by mixing of maternal and genital secretions. Usually all the viruses are transmitted during that time only. Okay, so vertical transmission is maximum at or around the birth through the mixing of maternal and genital secretion. Even if it occurs, okay, then we can prevent it by the active and passive immunization both. What is passive? In passive immunization, we give antibodies. In active immunization, we give antigen, and the body makes its own antibodies. So in the passive immunization, we give antibodies that we have to give to that fetus within 12 hours, because all those hepatitis B antigen which has transmitted during the cervical during the mixing of maternal and genital secretions during the delivery will be counteracted by this passive immunization. Okay, जो antibodies हम देंगे डिलीवरी के 12 घंटे के बीच में वो सारे उस एंटीजेंस जो डिलीवरी के टाइम पे मेटर्नल एंड जेनाइटल सिक्रीशंस के से आए थे उस बच्चे में, उस फीटस में, वो सारे काउंट्रैक्ट हो जाएंगे. सो द पैसिव इम्यूनाइजेशन, द एंटीबॉडीज अगेंस्ट द विटामिन बी, hepatitis B, is to be given within 12 hours. Okay, this question has been asked. The when is the antibodies against hepatitis B is to be given to the fetus? Within 12 hours of delivery. Okay, then the active vaccine is given, in which will build a long and strong systemic immunity. Okay, then the antigen is given. Okay, so both hepatitis B vaccine and hepatitis B antibody, both are to be given to the fetus or to the newborn who has come from the hepatitis B positive mother. Okay, I hope it's clear to you. Okay, maximum risk to the maternal mortality occurs if the mother is also hepatitis B. Along, hello Dr. Iman Abdullah, hello. If the mother has hepatitis E along with hepatitis B. Let me move the camera. This is a very important question. If the mother has hepatitis E along with hepatitis B, okay, if hepatitis E is also present along with hepatitis B, then beta, it is very certain that death will occur, maternal death will occur. This hepatitis E in pregnancy is such a dangerous infection. Okay, breastfeeding is not contraindicated in case of hepatitis B, C, HIV. Breastfeeding is not contraindicated. Okay, now let's see what happens in cholestasis of pregnancy. Now, what is cholestasis of pregnancy? There is accumulation of bile acid in the liver. Okay, and subsequently there is accumulation of the bile acids in the plasma. First, there is accumulation of bile acids in the liver. Subsequently, there is accumulation of bile acids in the plasma, and it causes pruritus and jaundice in the whole body. In the whole body, the patient has itching. What is pruritus? Pruritus is itching in the whole body. Okay, and there is also jaundice. So lot of patients come in pregnancy with pruritus, and when we get their bile acid tested, the bile acids are increased. Okay, so what is cholestasis of pregnancy? That there is accumulation of bile acids in the liver, and subsequently there is accumulation in the plasma. It is most common. Now, what all our question are asked regarding cholestasis of pregnancy? Now we know that there is accumulation of bile acid. It is most common in the last trimester. Okay, it is most common in the last trimester. Why is it so? Because in the last trimester, the fetus is at much fundal height, so it gives a lot of pressure to the liver. That's why its bilirubin does not exceed 5 mg, and SGOT, SGPT, which increases due to cholestasis, does not exceed 500 international unit. So you are going to learn this. Okay, you all know in HELP also the liver enzymes are raised. If along with liver enzymes the BP is high, then it means that it is HELP. Okay, along with the liver enzymes, the BP is high and platelets are reduced. What if the platelets are not reduced? Only liver enzymes are high and no BP is raised. then the answer is it is cholestasis of pregnancy. That is how the question is asked. They tell you that platelets is not raised. A pregnant patient come to you, platelet is not raised, liver enzyme are near 500, okay, and BP is also normal. Then you cannot categorize it as HELP. Then it is cholestasis of pregnancy. Mainly when a pregnant lady gets cholestasis of pregnancy, then the complications are fetal complication. Mother only has pruritus, itching. The fetus gets complicated a lot. What complication occurs in the fetus? Or meconium strain liquor, IUGR, IUD. So to avoid these complications, we attempt delivery at 38 weeks. Okay, the delivery is done at 38 weeks. So again, in preeclampsia, we do a premature delivery. Here also we do a premature delivery at for reaching 40 weeks. 38 is mature fetus, so we deliver it at 38 weeks. Okay, so once a lady enzymes has elevated due to the fear of the fetal complication, we deliver it at 38 weeks. Okay, before up till 38 weeks, we give the patient ursodeoxycholic acid. It helps to lower the liver enzymes and prevents fetal complication. Other drugs which we can give for the pruritus is antihistamines, cholestyramines, corticosteroids, but the best is ursodeoxycholic acid. This is the question which has been asked. Now let us discuss HIV in pregnancy. If the patient is diagnosed for the first time in the pregnancy, then ART has to be started. Okay, you are going to take patient as a very normal patient. ART has to be started. It is not that patient is pregnant and you are not going to give ART. Antiretroviral therapy has to be started. Okay. Similarly, we start the ATT just like in TB also we start the ATT. Here also we start the ART. Okay. We don't think that the patient is pregnant and we are not going to start. Okay. For TB, I want to add here one thing, that TB get flared in puerperium. TB flares in puerperium. Okay. In ART, there is a drug which is known as tenofovir alafenamide. Its short name is TAF. It is not recommended. It is not to be given. It is teratogenic. Okay, so we don't give tenofovir alafenamide, which is basically denoted by TAF. Okay, have you got it? So what are the drugs? Other drugs usually can be given. The preferred drug are tenofovir, TDF, okay, lamivudine and efavirenz. What are the drugs preferred in the ART? Tenofovir, lamivudine. What is the short form of tenofovir? TDF. Lamivudine short form is 3TC. And what is the short form of efavirenz? EFV. Okay. The basic first line therapy is same, to give 2 NRTI along with 1 NNRTI. Okay, the basic ART regime is same, to give 2 NRTI plus 1 non-nucleoside reverse transcriptase inhibitor. Okay, now let us discuss how we can prevent the HIV to the fetus. Okay, first of all, here I want to tell you that usually the fetus is not affected. In 80% of the time, the fetus is not affected. Okay, and if any transmission occurs, it occurs in labor. Otherwise, it does not occur. Okay, mostly at the time of labor. Okay, so elective cesarean decreases the risk of transmission to the fetus. Viral load of mother, more is the viral load of the mother, more is the chances that fetus will get the HIV. So what, which is a major determinant? Viral load of the mother is the major determinant of this, that HIV will be transmitted or not. Once again, usually the fetus is not affected. Whatever the fetus is affected, it gets affected during the time of delivery. So elective cesarean is the preferred mode of management. Okay, the factors which will determine that transmission to the fetus will occur or not, the most important factor is the viral load of the mother. Okay, once the fetus is delivered, whether by cesarean or whether by normal delivery, we have to give nevirapine, ठीक है, to the fetus. Okay, because it decreases the risk to much extent that only these days only 1 to 2% of the fetus are only affected, right? If mother is giving exclusively replacement feeding, I'm not telling you exclusively breastfeeding, exclusive replacement feeding, then nevirapine is to be given from the birth to 4 weeks. If the mother is giving breastfeeding, obviously the chance of transmission to the fetus will be much high. So it is given up till 6 weeks. Okay. So use of nevirapine in a fetus of HIV positive mother is must, because it decreases the risk of transmission of the fetus to only up till 1 to 2%. If 100 HIV positive mothers delivers a fetus, only 1 or 2 mothers, 2 fetus will be affected. If the mother is giving exclusive replacement, then nevirapine is to be given up till 4 weeks. Otherwise, the nevirapine is to be given up till 6 weeks. Now let us discuss hydrops fetalis. What is hydrops fetalis? Hydrops fetalis means that fetus has got or swollen, right? There is lot of the water in the fetus. There is ascites, there is pleural effusion, lot of these things. One reason for the hydrops fetalis is immune hydrops, Rh negative incompatibility. Okay, and the another reason are non-immune reasons. Now, as you all know that negative blood group occurs only in 5% of patient, 5% of population. So non-immune fetal hydrops is much more common. Okay, what is the cause of fetal hydrops? What is the cause of non-immune fetal hydrops? This is a very hot shot favorite of examiner. Okay, please focus here. This is very hot shot favorite of examiner. What is the causes of non-immune fetal hydrops? Okay, the causes of non-immune fetal hydrops are congenital heart diseases. When heart will not pump the blood, the circulation, the blood in the circulation, then of course the fetus will have ventricular failure and the body will go into hydrops. Okay, the fetus body will go into hydrops. So congenital heart diseases is the most common cause of non-immune fetal hydrops, right? The another reason is aneuploidies, Down syndrome, the Turner syndrome. These are the aneuploidies is the second most common reason. Third is the maternal infections. Why hydrops occurs in maternal infections? I will tell you. Because there are the cells which make RBCs. What is their name? Erythroid progenitor cells. The cells which make RBCs. What is the name of that cell which make RBCs in the fetus? erythroid progenitor cells. This parvovirus B19 affects that cell, erythroid progenitor cells, and now the fetus has anemia. No RBC is formed. Now the fetus has anemia. Out of anemia, there is hydrops fetalis. Okay. Among the torch, what is the full form of torch? Toxoplasma, rubella, CMV, and herpes simplex. All causes the hydrops fetalis except rubella. Okay, all causes hydrops fetalis except rubella. This was asked in the recent exam, that whether HIV causes hydrops fetalis or not. Okay, so HIV don't cause hydrops fetalis. What are the infections which are causing hydrops fetalis? Most common is parvovirus B19, and the other is torch, cytomegalovirus, and herpes simplex. After torch, now we will be studying about microcephaly. There was an epidemic of microcephaly in 2015 and 16, and the virus which was responsible for it was Zika virus. Okay, and among the torch, all of them, toxoplasma, rubella, cytomegalovirus, herpes, all of them causes microcephaly. Okay, but HIV not cause microcephaly. Okay, so in HIV there is no microcephaly, no hydrops fetalis. Please remember. And in rubella also there is no hydrops fetalis. Now let us discuss the heart diseases in pregnancy. Most common heart diseases in pregnancy is mitral stenosis. Since in India rheumatic heart diseases is very common. Okay, NOP is the mnemonic to predict the heart failure. Any heart diseases which is of grade 3 and grade 4 type, if it will have the high chances of heart failure. Okay, in obstructive lesions, the stenotic lesion, if the mitral is less than 2 and aorta is less than 1.5 centimeter, then there are chances of heart failure. Okay, if there was prior cardiac failure, arrhythmia, or stroke, again there are chances of heart failure in pregnancy, because you all know that cardiac output increases in pregnancy. If there was prior cardiac failure, arrhythmia, or stroke, if ejection fraction is less than 40%, again there are chances of heart failure. So all those patients who have this NOP criteria, they should not conceive and get pregnant. What is NOP? Once again, New York Heart Association, any heart diseases who is coming in grade 3 and grade 4, any obstructive lesion, stenotic lesion, in whose mitral valve is less than 2 centimeter and aorta is less than 1.5, any patient having prior cardiac failure, arrhythmia, or stroke, and if ejection fraction is less than 40%. So the heart diseases in which pregnancy is contraindicated is Eisenmenger syndrome, because the mother will surely die. Eisenmenger syndrome, primary pulmonary hypertension, okay, because mother surely dies in them. Marfan diseases along with aortic root involvement, okay. Uncorrected aortic contraction, because then it will be less than 1.5. Any diseases NYHA 3 and 4 grade, okay. So these are the diseases in which the pregnancy is contraindicated. In the Eisenmenger syndrome, primary pulmonary hypertension, Marfan, aortic root involvement, uncorrected aortic contraction, any diseases of the grade NYHA 3rd and 4th. Most common period in which the heart failure occurs, or you can say the patient expires, the heart diseases patient expire, is The most common time is immediate postpartum, because the cardiac output is maximum. The second most common time is the intrapartum, okay, during the delivery. If we take only the antepartum, the most common time is at 28 weeks. Okay, so this is quite commonly asked question. The risk of death to a heart patient in pregnancy is at immediate postpartum, because cardiac output is maximum at that time. Next is intrapartum, during the labor pains or during the cesarean. Then next is during the pregnancy, it is maximum at antepartum time, it is maximum at 28 weeks. There are 3 precautions which you have to take in the patient if you are delivering a heart patient. That normal delivery is more preferred than cesarean. Okay, in the first stage of labor, you have to give antibiotic prophylaxis, since rheumatic heart diseases are the most common cause. In the second stage, to cut short the second stage, we have to apply outlet forceps. Okay, and in the third stage, we have to avoid giving ergometrin. And in the fourth stage, stage is of the stage of observation of pph and other problems, that should be of 1 day. Okay, that should be for 1 day. Normally it is of 1 hour, but if the patient is you can say of heart diseases, then it should be for 1 day. This is a very common question asked, that fourth stage in heart diseases patient is for how much time. Instead of 1 hour, it is 1 day. Once again, the 4 precautions which you have to take in every during delivering the heart patient is: normal delivery is to be preferred than cesarean. Okay, and you have to give epidural painless, you have to do the painless delivery. In the first stage, you have to give antibiotic prophylaxis, since most common heart diseases is the rheumatic heart diseases. And in the second stage, you have to cut short the second stage by applying the outlet forceps. And in the third stage, you have not to give ergometrin, because methyl ergometrin is contraindicated in heart rate. It increases the cardiac output a lot. And the fourth stage is for 1 day instead of 1 hour. Okay, as we already studied that the risk of heart failure is maximum in postpartum stage, so the fourth stage is of 1 day. Right, let us study now thyroid diseases in pregnancy. Now, the hypothyroidism in pregnancy, there is a hypothyroidism in pregnancy is very common, because you know that HCG, alpha subunit of HCG is similar as that of TSH. So the thyroid gland gets stimulated by HCG. Okay, so because the thyroid gland gets stimulated by HCG, so it starts synthesizing T3 and T4, and due to the HCG TSH effect, the TSH decreases. Okay, so the normal TSH, which is considered normal TSH value which is considered is 3. In a non-pregnant lady, it is 5. But if a lady gets pregnant and as HCG has TSH like effect, so the normal TSH value is 3. Okay, so globulin increase in pregnancy. So thyroglobulin increase. We have studied in the physiological changes that globulin increase in pregnancy. So thyroglobulin increase. Now this increased T3 and T4, they get bind to the thyroglobulin. So there is in total free 3T, T4 are same. Only the TSH levels, they are reduced due to the HCG TSH like effect. Okay, So in a pregnancy, the normal TSH value is 3, right? So if it is a if the patient has TSH more than 2.5, we check the TPO antibodies. If TPO antibodies increase, then there is a high chances of maternal and fetal complications. Okay, so TPO antibodies are indicator of maternal and fetal complications in the thyroid problems. If the TSH has increased, the mother is getting hypothyroid diseases, so you have to get the TPO antibodies. If TPO antibodies are increased, it means this is a complicated thyroid. The treatment is, of course, the treatment of hypothyroidism is tablet thyroxine. And if already the patient is a case of hypothyroid, then we have to increase its dose by 30 to 40%, right? Last but not the least slide, hyperthyroidism. Hyperthyroidism means that the thyroid is less than 0.1. Okay, hyperthyroidism is thyroid TSH has got decreased. If TSH is less than 0.1, then we label it as hyperthyroidism, as we will give the anti-thyroid drugs. So these drugs will also act on fetus, right? And fetus is very sensitive. Thyroid hormone to the it is a thyroid hormone is a main hormone responsible for the fetal growth. So we have not to treat the mother fully for hyperthyroidism. Slight hyperthyroidism is left. As I already told you, methimazole and carbimazole, they are contraindicated in pregnancy as they cause choanal atresia and aplasia cutis. The drug which is safe in pregnancy is PTU, propyl thiouracil. Okay. If you have any problem, then you can ask me. Otherwise, we will be closing the session. Dr. Haley is asking, ma'am, warfarin can be given in second trimester? Yes, beta, it is given. Warfarin is only stopped, replaced by heparin in first trimester. It is given. Any other problem? Any other query? Beta, Dr. Iman is asking what is the treatment of cholestasis. In cholestasis, bile acids increase. So we have to do the delivery at 38 weeks, and we have to give ursodeoxycholic acid, which decrease the bile acid. The treatment of cholestasis of pregnancy is the drug ursodeoxycholic acid. Okay, is it clear? Dr. Chef is asking, blueberry muffin syndrome common in congenital CMV or rubella? I think it is common in congenital CMV, but I have to recheck it. Dr. Sheffi, as far I remember, it is common in CMV, congenital CMV. I will check and tell you. Any other queries? Can we close the session if queries are there are no queries then?